Up first, from Westside Veterinary Clinic, Dr. Jill Brady. Doctor, welcome in.
Thanks for having me. I'm excited to be here.
Yeah, give us a little of your veterinary background. So many folks know our friend, Colonel Rick Combs.
Sure, yeah.
You and Rick are a family.
That's right. I have been practicing veterinary medicine it'll be 22 years this month. And I started working at Westside Veterinary Clinic as a kennel person. And before I started vet school, so I've worked there as a kennel person, a technician, and a veterinarian. But I went to vet school at Iowa State University, which was a family thing. My aunt graduated from there. And after graduation, I practiced in North Carolina for 6 years, came back here for 2 years, went down to Florida for 5 years, and now I'm back here, and I'm very, very happy.
Good operation at Westside. Boy, a bunch of good folks who are truly pet people.
Yes, they are.
Talk to us about the big thing we were going to talk to you about is something very cutting edge in veterinary medicine, but goes back thousands of years, and that is veterinary acupuncture.
That's right. Veterinary acupuncture has been around for thousands and thousands of years. Acupuncture in general gained popularity in the United States after Richard Nixon went over to China. And they did an anesthetic procedure using just acupuncture, and he was so wowed that he came back to the United States and started pushing it here. So I know my predecessor, Dr. Sherry Russell, who owned a practice here in Jefferson City. I don't know exactly how many years she's been practicing veterinary acupuncture, but I know it's over 22 because I went and shadowed with her before I started vet school. So actually, veterinary acupuncture in this area has been going on for at least 22 years. And I'm excited once Dr. Russell decided to retire from that part of veterinary medicine. She contacted me and said, "Hey, are you interested in doing this? I know you had an interest in it before." And I said, "Absolutely. What do I do? How do I do this?" So that led me to looking for a school to train.
We told you off air, we were talking to our friend, Dr. Chris Link from Integrative Medicine at Capital Region, who does acupuncture in his practice and all. And we were teasing him saying, yeah, but unlike Dr. Jill, your patients don't tend to bite you when you stick them, right?
This is correct. Although I will say the great majority of my patients, it becomes after, especially the first couple of treatments, a very relaxing thing for them. I've had a dog fall asleep while we were doing a treatment. The cats are a little less cooperative sometimes than the dogs are, but for the most part, they're pretty good. They don't bite me, but I am a little jealous. I wish my patients wouldn't try to bite me.
What kinds of things do you use the acupuncture for?
Primarily, so far, what I've used it for is a lot of arthritis issues. It's great for pain. We've had some really dramatic cases of dogs and cats that have had trauma to their spine and they lost the function of their back legs, and we were able to help them regain their function. When sometimes surgery isn't an option, or even sometimes when surgery is done but you still don't have good function, we can really help with that, with neurologic problems like that. It works great for seizures. It works very well. We use it sometimes. I've used it even before I was trained in it. I used some of it during anesthetic procedures. If you have a patient that for some reason isn't breathing well under anesthesia, there's a point that you can use for anesthetic apnea, and that will help them breathe. So it's something, there's lots of uses. I use it for a dog who has skin problems. You can use it for urinary tract problems. You can use it for incontinence. You can use it for coughing. I mean, it really fills in the gaps nicely where maybe Western medicine can't go with our medicines or our treatments. Of course, acupuncture can't fix a broken leg, but it sure can help with the healing process afterwards. After the bone has been set, it can help with the inflammation and the pain. And so, you can't use it for everything, but it really dovetails nicely with what Western medicine does.
Well, you were talking about the literally thousands of year history of it. We did a little checking on the internet, and they talked about the Chinese thousands of years ago using it on war horses.
Sure. They used it. The points that we have for animals were all extrapolated from people. So they did kind of like what we do. They said, well, when we needle this person right here, we get this response. And so when they would have a injured or lame horse, they would treat in roughly the same place. And if they noted the same response, then they said, great. Okay, that's a point. That's a place where we can use it again. And they were very good at record keeping and recording what they found and passing that information along over the years. And it's changed, it's evolved over the years, of course, but it certainly has improved but it's continually changing too.
Horses were much more valuable than the soldiers at that point.
They were.
A lot of soldiers, not many horses back in those
Probably
days.
a really good point. Dr. Jill Brady in with us this morning, Westside Veterinary Clinic on KWOS Open Air, 556-63997. We see all the shows on TV with the dog whisperers and all that. And we talk about non-traditional treatment of pets. So much of it, the whole psychological side of pets and all that, that has become a big growing area in recent years, hasn't it?
Mm-hmm. I think, I'm not sure how I don't have a lot of information about the dog whisperer, and I know there are people who claim to know what pets are thinking, and but I can tell you, we've really tried to get into the fear-free aspect of veterinary medicine, where we want pets to come in and we don't want them to feel like they're at the doctor's. We don't want that white coat syndrome. So we try to help them be more relaxed, because a more relaxed pet is going to respond better to treatment and heal faster. So our goals are to help those pets come in and feel like they're at home. We give lots of treats, lots of love. We have them come in for happy visits, and we try to make it a positive thing, because I know with humans as well, if your mental well-being is good, then your physical well-being will also be good.
Dr. Jill Brady with us, Westside Veterinary Clinic, as we continue our discussion on KWOS Open Air. They may talk about ticks and fleas and pet allergies and all the fun. They have just as much fun this time of year as the rest of us do. When we come back with Dr. Jill Brady on KWOS Open Air. Dr. Jill Brady in with us this morning from Westside Veterinary Clinic. We were talking to you off air, not to leave anybody out of the loop, talking to you about ticks and fleas, and man, oh man, dog at our house is just already covered with ticks.
Yes, it's been the whole winter we were still seeing ticks and fleas, and it really has to get cold for a significant period of time below freezing for ticks to go away. And fleas pretty much just never go away, because they can always come indoors on the pets. And so fortunately we have a lot better flea and tick products out there than we used to have. We were talking about we used to dip them for fleas, and fortunately we don't have to do that anymore. We've got lots of good topicals and oral medications, and even some good flea and tick collars out there as well that you can use. So
it's one of those years. It's just one of those kind of challenges, and it's even if I think people sometimes have the misconception, if your pet is largely a house pet, they go outside to do their business and all, they're just as susceptible as a pet lives outside, aren't they?
Absolutely. We hear that a lot. We hear that a lot for fleas and ticks, and also about heartworms. And heartworms are carried by mosquitoes. And I tell people, this winter I saw a mosquito in my house. But so a lot of people are under the misconception that, well, my pet just goes outside to go potty and comes right back in, and that's all it takes to pick up a flea or a tick, or again to be bitten by a mosquito. So
I had breeding stock back in the day a female that tested positive for heartworm and had to go through that whole expensive procedure and all. And now with the prophylactics that are out there to keep them from getting those diseases, it's nice to be able to be in that side of it in this modern era, isn't it?
Yes, it is. It's great. We still have, we've had the oral. I remember when I first started practicing, they still had something called Filaribits, which is a once-a-day heartworm prevention that you had to give them. And if you forgot a day, then you could be in trouble. Now we've got the once monthly. We've got the Pro Heart injections, which last for 6 months. We've got topicals for heartworm prevention. So there are a lot of really good options out there.
I know the MU Vet School did some real cutting-edge research on heartworms for many years up there.
Yep.
One thing that has been brought up with my dog, getting to be a little bit of an older dog, and something I hadn't really thought about, because I've had other dogs for years. A lot of focus on dentistry, pet dentistry these days. I've never brush my dog's teeth, but I don't think it'd be very much of a fun thing to do.
Especially if you have to use your toothbrush.
My toothbrush, yeah, it just gets all crummy and stuff like. But so tell me about the pet dentistry and the latest in that these days.
Sure. Pet dentistry, that's something that the pets with bad teeth have been around for years, because you're right, most people don't brush their pets' teeth. Some dogs and cats will not allow it. Some will, and I've talked to people about easy ways to help get their pets used to having their teeth brushed. But we still see a lot of pets that come in with teeth that have tartar buildup. The gums are red, bleeding, pulling away from the teeth. I've seen teeth literally kind of waving in the wind. And just some really disgusting things in their mouths. And if their mouths aren't healthy and they have all that bacteria in their mouths, their body's not healthy. It's a whole body kind of thing. So it's important to at least look in your pet's mouth if you don't brush their teeth every day. The other great thing is there are some good pet treats out there that you can give your pets to help, but brushing is still the best way to prevent that. But I mean, we see a lot of pets. We do dental X-rays, just like the humans do. We polish, we scale, we polish. We of course have to do that under anesthesia, but we extract teeth, and we do a lot of the things that human dentists do, because it is so very important to the overall health of the pet.
Beyond the tartar buildup, what are some of the other signs you need to look for from your pet if they're having dental problems?
Bad breath. What you notice first usually is the bad breath. We'll have somebody come in and say, man, my dog's breath really smells, or my cat's breath really smells, and we'll look in there and we'll see usually inflamed gums and a lot of tartar buildup. And what you're smelling is the bacteria. The bacteria adheres to that tartar on the teeth, and then that's what also causes the gums to become inflamed and start to pull away from the teeth, and the teeth to become loosened. So it's definitely something it's like heartworm disease. It's a lot better to prevent it than it is to have to deal with it down the road.
Dr. Jill Brady in with us from Westside Veterinary Clinic this morning on KWOS Open Air. Can we talk about pet food a little bit? Because as Dick was talking about having a pet, it's getting a little older up there. A lot of times they end up on a specialized diet. And man, if you go into one of the pet food stores or even the big box store, you're overwhelmed by all the choices sometimes.
There are a lot of choices out there. And right now, kind of the hot button topic is grain-free. I think a lot of people, through really smart marketing on some pet food companies' parts, believe that grain-free is better. And it is if your pet is allergic to those grains. Otherwise, it really doesn't make a difference. Corn kind of got a bad reputation there for a while, but corn actually provides a lot of really good nutrients and things to dog foods and cat foods. And so it's not a bad thing. If you go into the pet store, there's a plethora of different foods, and you can really become overwhelmed. I would really encourage people to talk to their veterinarians when they make a choice, and not rely on the person in the pet food store. Even though they may be very knowledgeable about that food, they're not exactly as knowledgeable about your pet. So they wouldn't know necessarily if your pet has had kidney problems in the past, or urinary tract infections, or something that may need a special diet. And you can't get the quote unquote prescription diets through the pet stores. You have to get those from a veterinarian, and those are typically diets that your pet would need to likely be on for the rest of their lives. So you can't get substitutes for those. Yeah,
that's my dog has been on a special diet since she was 2 years old. I was used to having dogs lab mixes and those kinds of things. They could eat anything, and
often did.
And yes. Often did. Yeah, eat everything they could find, including wood and everything like that. And our little frou-frou dog wound up with a bad tummy, and had actually stones removed. So she's been on this diet that's quite pricey for the last 8 or 9 years. But
she doesn't eat much at a time, right?
No, she doesn't eat much at a time. Thank goodness. Yes, that's the big thing about it. But yeah, that can happen. That definitely can.
Talk to us about hot weather, and also in the summertime pet allergies. You know, people talk about being allergic to the pet, but the pet can be allergic to a lot of things outside, can't they?
Sure. Pets can be allergic to pretty much anything that people can be allergic to. So they can have allergies to pollens and molds, and they can be allergic to fleas. We see a lot of pets that are actually allergic to fleas. So, and when I say fleas, I actually mean flea saliva. So they're allergic to what the flea, when they bite the pet, they excrete the saliva, and that's what those pets are allergic to. They can be allergic to human dander. We know some dogs that are allergic to people, which is sad. They can be allergic to cats. Cats can be allergic to dogs. Again, house dust. I mean, they can be allergic to anything. But summertime is especially bad because we know in Missouri allergies are bad here, or pollens are bad, and so we do see a lot more allergies. And fortunately, we have some really good medications out now that help these pets quite a bit deal with the itchiness that they get. They will tear themselves up scratching sometimes and need, antibiotics and things like that. And we can prevent that with some really good medications that are out there now.
I always thought that was kind of the whole amazing part of being a veterinarian is just the whole diagnosis part of it. When you have a patient that just literally, you can tell that they don't feel good, but they can't tell you.
Right. I think that's my favorite part is they come in and your job is to look at the subtle signs. And I feel like it helps us. We have to look at how they're acting, what they're not telling us. We go by what their owners tell us, but we also go by what the physical exam shows us. But that's my favorite part is trying to piece that puzzle together and figure out what's going on.
Dr. Jill Brady, Westside Veterinary Clinic, in with us this morning. KWOS Open Air.